Hi, I'm Alex Rame, and on today's episode of First Aid, we talk about diabetes and epilepsy.
Diabetes.
What is diabetes? Diabetes is the body's inability to produce insulin in the pancreas, leading to abnormal metabolism. Diabetes is a lifelong autoimmune disease that occurs most often in children aged from 0 to 14 and is one of the most common chronic diseases found in children. An estimated 130,000 Australians have type 1 diabetes, with approximately 2,400 Australians being diagnosed each year. What is epilepsy? Epilepsy is a neurological disorder marked by the sudden, recurrent episodes of sensory disturbance. Epilepsy is the most common serious brain disorder. Over 250,000 Australians are living with epilepsy, with roughly 25,000 people being diagnosed every year. Epilepsy is most frequently diagnosed in infancy and old age. Around 5% of Australians will experience it at some point in their life. If somebody is suffering from diabetes or an epileptic fit, remember to follow the 3 steps: identify, assess, and manage. The nature of physical environment may, in part, have been responsible for the occurrence of the accident in the first place. It is important that protective measures be observed and strategies put in place so that further injury does not occur.
The 3 environments that present the most danger are traffic accidents, water environments, and electricity.
First, the legal obligations. The legal obligations of providing emergency care are often a cause of concern for many people. A first aider could be expected to use responsible care in assessing the priorities. First, take steps to call for further medical assistance. Keep the casualty stabilised until medical assistance arrives. Follow the established treatments and management protocols, and not to misrepresent yourself or take unnecessary risks when treating the patient. Another legal obligation is to ask for the person's consent when applying first aid when they are conscious. Can I help you?
No.
We're not legally obliged to help this man, so we continue on. In emergency situations, there exists a moral responsibility to provide assistance to the injured, as it would be considered responsible to help the patient. Morality suggests that we should help to the best of our ability. For example, if trained in first aid, you are morally obliged to assist the casualty. How to identify if your casualty has diabetes? Declan, you have diabetes. Possible symptoms are increased urination, increased thirst, irritability, aggression, and possible palpitations.
I think I'm having a low.
If your patient has low blood sugar, check for rapid pulse, profuse sweating, trembling hunger, aggression, or dizziness. Treat it by giving them some glucose.
Thank you. I think I'm having a high.
If your patient has high blood sugar, check for rapid pulse, drowsiness, possible progression to unconsciousness, and thirst. You're supposed to go. Possible progression to unconsciousness and thirst. If a diabetic casualty has gone unconscious, it's important not to give them any more food or drink, but instead to call emergency services and administer an insulin shot if they have one. If a casualty has epilepsy, their symptoms can include rigid body, tightened jaw, some mouth frothing, possible loss of bladder, or loss of consciousness. Identifying that spasms come in 2 cases: petite and grand mal. Petite mal seizures or partial seizures are brief, usually less than 15 seconds, and have symptoms that are barely noticeable. A grand mal or generalized seizure features loss of consciousness and violent muscle contractions and is more common than the partial seizure. When managing a seizure, it is important to stay calm, Look around and remove any objects from the immediate area that may cause some harm. Note the time that the seizure started, stay with them, and put a cushion under their head. Remember to call emergency services and not to restrict their body from moving or put anything in their mouth. Once the seizure is stopped, it is important to put them in recovery position and stay with them until they're fully recovered. In conclusion, when it comes to diabetes and epilepsy, it is important to be aware of how to identify, assess, and manage the scenario. There are also legal and moral obligations that everyone should be aware of when assisting a patient. An awareness of the physical environment that affects the incident. Following correct procedure and helping the patient as soon as possible increases the speed of treatment and lowers the risk of further harm being done.